Higher Education Department has confirmed that 55 students at the University of Pretoria have tested positive for COVID-19. In response to the news, Higher Education Minister Bongiwe Zwane has expressed concern over the pockets of infections within the tertiary environment. For more on this story, I'm joined by Professor Ramneek Ahluwalia, who's the CEO of Higher Health. Good evening, Prof, and thank you so much for your time tonight. How serious is this? I mean, some people may think 55 is a small number, but certainly when you put together some of the contact tracing lists, it doesn't look like a small number at all.
So you're right, Bongiwe, this is concerning, and thanks to you and the media houses to help us alert everyone around. Yes, 55 people who are positive. And you must remember that, these are cluster outbreaks. So these are young people. This has been also a testing time because these are orientation months, induction months. So the first years come into the institutions. These are unspoken realities where people mingle with each other. They have parties. These are super spreader events that happen. And what happens is that if a group of people become positive, they go back to their residences in congregate settings where they transmit the virus from one individual to the other. And it then rapidly spreads around to many people around in the congregate setting. So residences are very vulnerable. And remember, we are a very youth-centered sector. And the new variants are showing very high affinity to young people. So I think young people unknowingly become huge carriers of this virus. If you recall, before the second wave, when we had post-metric Balito rage parties, and you had so many students becoming positive or learners, and when they came back into the different provinces, specifically Gauteng, so many spread the virus to so many people in the communities and the families when they mingle with them. So I think that's where the chain of the virus moves very, very quickly, and that leads to a second wave. And all the alert at this moment is these pockets of cluster outbreak that we're seeing among young people should not lead us into a similar kind of a disastrous third wave. So at this moment, if we can act quickly, we can we can work around it, we can put systems and controls together and break the chain of the outbreak, then we can control this. And I think we need social compact and solidarity through everyone at this stage.
And before we zoom into the vulnerability of the residences, talk to us about the process that is unfolding now, because 55 students, then they've got contact tracing lists. What is being done now to ensure that a further outbreak is contained?
So as soon as we found a group of students that were positive, and that defines a cluster outbreak, which is at one time more than 8 students or 8 young people become positive at the same time and they are in a congregate setting, we define it as a cluster outbreak. And once the cluster outbreak is defined, then Higher Health has got a full protocol on cluster outbreak. We work with local Department of Health, NICD, National Health Laboratory System, WHO, and we develop an investigation team with the university or the institution. This is not something which is happening only now. It happened during the first wave and the second wave, where many other institutions in different other provinces went through the same cluster outbreaks, predominantly in campuses or in residences, where it spreads very quickly among young people. So the trick is, how quickly can we start identifying how many people are in contact with each other in the community, families, and in the campuses? How quickly can we contact trace people around the entire system? So at this moment, we've got 13 residences, and we've got about 3,000 young people who we know are in close contact with each other and have a potential of being severe contacts of the numbers that have become positive. So since Saturday, day and night, we are doing contact tracing, screening, and testing program. With the help of NHLS, we are trying to reduce the span of delivery of results, so that if the delivery of results is shortened, say, from 24 hours to 12 hours or 8 hours, we get quick results, we quickly isolate people and put into quarantine, and we break the chain of the outbreak. So the process it's very difficult. It's not as easy as it sounds. But to contact trace everyone in community, family, and into campuses, because it's a circle where things have happened, It takes a very laborious job. I must thank the institution for working extremely hard day and night in getting this under control for now. But the fear is that this happened predominantly close to the Easter break. So we knew students are going to go back to their families, going to go back into the community. So there's possibility that some of these contacts might go escaped or might not be tested or screened and unknowingly carry the virus to the communities and families. So the alert is important so that when even if they go home, following the masks, following the physical distancing, and most importantly, young people need to know they have higher affinity to this virus. If you look at South African data, 21 to 30 age group is the highest positive for COVID. The next age group is 30 to 40, clearly showing the early youth and adulthood is very, very sensitive to this virus. So, and they are not highly fatal to this virus, but they carry this virus to the elderlies, to the comorbid people unknowingly. And because they're asymptomatic or mildly symptomatic, that's where the real fatalities happen, and that's where the whole wave picks up into lots of patients coming to our hospitals, the system collapsing, and the process. So the alert is very important that it happened close to the Easter vacation. We knew Easter holidays are going to be where families meet together, communities congregate together, and we had a cluster outbreak just a week before. And we do not want something very similar to what happened into rage parties around in the before wave. And that's very sensitive for us at this stage.
And how does this affect things next week? Because obviously, as you say, they're with their families now, but they are coming back, next week, starting from Monday afternoon or Tuesday. How is this going to affect, things as we go into next week?
So not only just the university that we are talking about, in fact, the alert has been sent to across all the 9 provinces and to almost all our universities, our TVET colleges, our CET colleges, private higher education institutions, everyone. Because I think the linearity of this pandemic is across everywhere, and these students have gone all over the communities to come back. And young people are carriers. So the protocol, the systems that we have developed over the last 1 year, we've established 30,000 frontline workers. We have brave student volunteers who day and night risk their life and do screenings, contact tracing with the help of higher health teams. So I think it's about getting back to them. What we are doing over this Easter holiday is preparing towards the receiving of the 6th of April when the students are going to come back. And I want to say, really apologize to students because it is their youthfulness, it is their time when they should mingle. This is orientation, but we are asking them for a social compact this time. We really have to be working very closely with the governing bodies, with the student governing bodies, the student leadership and students themselves, because there is no other way in a pandemic like COVID-19 where we can win without a social compact between the students and us. So I think we are very vigilant. It's very important to put this alert together. It's brave for us to go and speak to everyone around, whether it's parents, guardians through the media, whether it's management, whether it's frontline workers, whether it's our security, wardens, resident officers. And I think that's exactly where the capacity building, science and training happens, to put the infrastructure for receiving them so that everyone understands that this is not going to be an easy time when the 6th of April happens.
And let's talk then finally about the vulnerability of, the residences themselves, because as you say, students like to mingle. This is a time where they're getting to know each other, they're making friends, others are coming back and they want to see some of, their friends that they haven't seen in quite a while. But what measures are being put in place to ensure that there is policing around the area of adhering to safety protocols? Because we have been seeing that some of the students are simply not adhering to these.
The most important thing at this moment is that residences are congregate settings. A congregate setting is where people live together, reside together for much more hours. And that's exactly, we know, in closed dwellings is where the virus moves very quickly. So you're dining together, you're living together, or you're meeting together. So how do you put strengthening protocols in terms of and before even we put the protocols, does the wardens, does the security, does the management and the the frontline team understand the virus in a scientific way. And I think that's the most important part. So whenever cluster outbreaks happen, or predominantly before, what higher health has been doing is putting this capacity of number of protocols into everyone, including the student leadership, so that we stand together in order for us to understand how do we prevent infections to come in. Now, the other important thing is the protocol is very hard on the securities, very hard on policing, very hard on management and the student bodies towards addressing this. But, as much as it's easy to say, these are 2.5 million young South Africans in the post-school system, rural, informal settlements in our surroundings. Things do escape. People do take chances. Young people are asymptomatic. They believe this virus does not affect them, and that's true because most of them remain asymptomatic. But the challenge is they are the biggest carrier. If you look at India right now, the biggest pandemic of the second wave is through the young people. If you look at US, look at European data. So I think youth needs to realize that they are the epicenter of where this virus can become a huge carrier from one individual to the other, lead to more mutants, lead to more variants coming, lead to more loss of deaths in the elderly, in the comorbid areas and the young people. So I think it's a very sensitive time for the country, for global world, and for the youth themselves. So it's about how do we communicate, and through media channels, the aim is to speak to the parents, guardians, student bodies, students themselves, and everyone on grounds of why it is so critical and why it's so sensitive.
Certainly does look like a busy weekend ahead for you there. That was Professor Ramneek Ahluwalia. Thank you so much for your time tonight. He's the CEO of Higher Health. And still